This is my redo of my demonstration speech. Um, Here we go. Did you know choking is the fourth leading cause of death in children in the United States? One child dies from choking every 4 days in the United States. Choking is not just a medical emergency, it can happen to anyone at any time. Common everyday foods such as hot dogs, popcorn, and grapes are the most common choking hazard in children, and knowing what to do could save a life. I've been a paramedic for 13 years and have provided care to more than a few choking babies. First aid training for caregivers reduces preventable injuries and death among children. This course is not to um, substitute taking a first aid class. This is just to give you some basic knowledge of what to do if you're ever in that situation. What I'm going to go over is how to recognize choking in children, steps to relieve choking in children, and how to prevent choking in children and infants. I have my personal assistant here with me. This is Annabelle. I'm going to go over what to look for choking in children. One of the first things is if they're coughing and they're still moving air, they could be choking, but it's not to the point to where it might need the intervention that we're going to go over. Um, some of the things you can do if the baby is still coughing and moving air and crying, you can turn them over on their side. That can help relieve the airway obstruction if it's not a full obstruction. And sometimes just turning them down on their tummy can help the obstruction come out. If the baby's not coughing or the baby is turning colors and they're not breathing, one of the first things we're going to do is we're going to call for help. We're going to call 911 so we can get the proper resources on the way. And then we're going to look to see if we can see anything in the mouth or in the airway. We're not going to just blindly stick our fingers in the baby's airway. That can actually make it worse. That can push it even deeper. So if we do see it right at the edge of the mouth, we can take our fingers and we can just gently pull it out. Sometimes that's all that we need to do. But let's assume for this, the baby is actually choking. The baby's turning blue around the lips, which we also call cyanosis. It's just the blue color. You might see it in the hands and the feet. Also, your baby's not crying, and you can tell it's an obvious distress. After we've called 911, some of the things we can do is take the baby. After we look for it, we're going to start with back blows. We look in the mouth, we see that we can't see anything. You want to take the baby, face it palm down in the palm or face down in the palm of your hand. And then you're going to take your hand, kind of tilt the baby down. I'm going to move the camera down a little bit. And you're going to do what we call back blows. You're going to hit right between the shoulder blades, enough force that you are going to be able to dislodge it. You do 5 of these, and then after that, you flip the baby over into your other hand, and then you check the airway to see if you can see the obstruction. If not, you're going to take 2 fingers, place it on the sternal of the chest between the breast, and you're going to give 5 chest thrusts, at least 1.5 inches. 1, 2, 3, 4, 5. After that, we roll the baby back down, face down, and do 5 more back blows. 1, 2, 3, 4, 5. Baby over. Check again. If we don't see anything, we're going to do the chest thrust. 1, 2, 3, 4, 5. After that, we repeat the process. 1, 2, 3, 4, 5. We're going to say that the object has now came out. Best case scenario, the baby will start crying. We're going to continue that until the object becomes dislodged, help arrives, or the baby becomes unconscious. At that point, it's possible that the baby will need CPR that will have to be covered in another speech. So, in conclusion, When it comes to children and their airways disorders are one of the leading causes of infant death. Seconds matter. And if you're a parent, babysitter, or sibling, or even a stranger, you can make a difference in a situation like this. You never know when it's going to strike. Infants can also get brain damage by just 4 minutes of choking with no air movement. So, some of the main points to take home with you in this is recognize choking, calling 911, and look for anything in the mouth that can be removed, and then performing the back thrust and the chest thrust until it's dislodged or help arrives. And babysitters, it's really important to pay attention. This can be the difference in getting paid and getting sued. No one wants to get sued. We all want to get paid. Thank you.